psychedelic drugs are commonly reported to trigger life-altering, mind-expanding inward journeys. But since being scheduled dangerous and illegal, any therapeutic benefits have gone largely unrecognized. Mental health treatment hasn't changed in generations, limited primarily to psychotherapy and a broad drug class called SSRIs, or selective serotonin reuptake inhibitors.
So there's been no new drug in psychiatry essentially since SSRIs back in the 1980s.
These drugs have varying results, often with side effects, and can be seriously habit-forming.
Once you get on one SSRI, they've got you for life pretty much.
But this model could soon be disrupted by the acceptance of psychedelics by the medical, psychiatric, and pharmacological communities.
This is now coming at the forefront after spending 60 years in hiding.
And these tools actually have remarkable healing potential and have had for thousands of years.
LSD, psilocybin, DMT, MDMA, and other consciousness-altering compounds, once labeled dangerous and illegal drugs, are coming into the political spotlight. A recent ballot measure in Oregon authorized the legal use of psilocybin by licensed providers. Clinical trials are pressing forward in what could forever change the way we understand and treat both the mind and the body. Investors are flocking to stake their claim in this new frontier of magic molecules.
What is really driving us here is the fact that the efficacy rates here cannot be ignored. They're profound, and money will follow efficacy.
But these investors aren't just hedging their bets. They're true believers, intent on flooding psychedelic startups with the capital they need to invoke a revolution of the mind.
Neurogenesis.
Jesus Christ.
And this is an easily measurable metric. From psilocybin experience, while he was fully on the experience, he said he did not use his hearing aid for 3 or 4 days. Now, I've mentioned this to
Why didn't he just do mushrooms again and keep the hearing aid off?
Well, that's basically he ran out of cubensis. And so he had to put his hearing aid on. And he was asking me for cubensis, and I said, I'm sorry, I can't provide it to you. So I've mentioned this now to several of the clinical researchers who have DEA license who are doing clinical research. This is an easily measurable metric. You can, as people are fully, in these sessions, they could be giving them auditory stimulation to see if the auditory nerve is undergoing neurogenesis. They're like nodes of crossing, and there's an interconnectedness that occurs. And there's a great graphic, which I didn't send you in advance, showing this is your brain without psilocybin, this is your brain with psilocybin, and there's a massive amount of neural connections that are occurring. So I think, just like water chooses the path of least resistance, I think that neurologically, if there is a neurological pathway that can help you as a species, as an individual survive, should there be a saber-toothed tiger on the horizon, then I think that the economy of energy in nature would reward the neurological pathways that are most likely to lead to your survival.
For the most part, most psychedelics are illegal. And if you really think about it, it's kind of fucked up that literally majority of psychedelics, besides maybe let's say ayahuasca or iboga due to religious reasons or under the Religious Act, thank God, are illegal substances. And yet, what's more striking is if you look at the scientific evidence, specifically for psilocybin, which has been studied quite frequently and quite extensively, the benefits are amazing. I mean, absolutely amazing. Personally, for me, my own personal experimentation, I can say that magic mushrooms is probably one of the best tools in the tool set that I have, especially when it comes to microdosing with shrooms. Maybe every third, fourth day, as MAP says. By the way, if you guys aren't aware of MAPS, which is Multidisciplinary Association of Psychedelic Research, which is founded by Rick Dublin, I highly recommend you check them out. I will leave a link below this video for this. Anyways, I want to talk about this study. It's not too recent. Well, actually, it's pretty recent, October 2017, talking about magic mushrooms rebooting the brain in depressed people. But this isn't just any depressed people. They were talking about people with depression who also were undergoing cancer or had cancer. And they tried every treatment. They tried, let's say, antidepressants, they tried certain different modalities, but everything failed. But yet when it came to doing magic mushrooms and psilocybin, the results speak for themselves. And what's really more fascinating is one dose of psilocybin was enough to help them out 6 months later. So once they took the one dose, the beneficial effects of that one dose from psilocybin lasted 6 months afterwards. What's pretty cool though is, let me pull this up over here. Where is it? Here it is. The imaging, so they did a fMRI, magnetic scan of the brain when it came to psilocybin. So on the left, you're looking at communication between brain networks and people given psilocybin, which is psilocybin is on the right, and non-psilocybin, which is on the left. Let me move my mouse over here. Look at the brain activity of people on psilocybin. And what's really cool about this, I haven't pulled up the study over here, but they have another study talking about psilocybin with the potentiality of regrowing back glial cells. So it has the potentiality and the properties of neurogenesis, of regrowing back your brain cells, which is amazing. Like, that's amazing for people who have epilepsy, that's amazing for people who have depression, that's amazing for people who have Parkinson's, that's amazing for people who have brain cancer, etc. Anything to do with neurological issues, that's amazing.
Hi, how's everybody doing today? This is Rich here on behalf of Rich TV Live with our very special guest. It's J.R. Ron from Mind Medicine. How are you doing today, J.R.?
Hey, how are you doing?
I'm doing fantastic. It's been a very exciting couple of months for you. So how's everything going?
Things are going well. It's definitely a dynamic time in the markets, and also I think for the world right now. But I think the things that we are working on are really going to be needed as part of the recovery post-COVID. And so just been really kind of heads down executing and building our portfolio.
Very good. Now, last month, it was revealed to the world that MindMed is developing LSD neutralizer technology to shorten and stop LSD trips. How was the technology discovered?
Well, it's a good question. I don't know how much I can answer about it, just because we have recently filed a patent application around the neutralizer. However, what we're really trying to do with this is, I think when people ask me about psychedelics and psychedelic-assisted therapy, one of their biggest fears is, well, what if I have a bad trip? What if I have a bad experience? And in many ways, those experiences can be some of the most therapeutic, but at some point, they can just also be too much. And so we wanted to remove the anxiety around going and getting treatment. And so what we thought the best way to do that is to let people know that there is an off switch. You can go in for therapy, and your therapist or doctor has the ability to shut off the experience. And so that is really what that technology surrounds itself with and wants to become. We feel that this is more a feature and not a standalone product, but it will differentiate us in the market if we are to get it ever approved. So that's what we're working on with the neutralizer.
Very good. Now, there's lots of exciting things happening with MindMed right now. You recently announced that the company has closed a $13.2 million financing to advance the Lecti Lab collaboration. Can you tell us more about the collaboration?
Sure. So, Dr. Matthias Lecti is the leading researcher on LSD and MDMA globally. He's been researching these substances for many, many years. We were able to acquire all the historical data based on the work that he's done over the last 10 years. And with that data, we acquired about 8 clinical trials in the LSD space that are completed or ongoing. And then we acquired, I believe, an additional 9 clinical trials or studies based on MDMA. And so what we can now do is take all that data and develop IP positions around it for the company, and also use it to formalize how we're going to go into new clinical trials.
Very good. Now, on May 27th, you guys just have news coming nonstop. MindMed announced some big news that it would be adding MDMA to its R&D portfolio to develop next-gen psychedelic therapies. Tell us more about the research and how MDMA will help the company's mission to prevent mental illness.
Yeah, so look, MDMA is clearly a very important component of psychedelics and the entire industry. MAPS, which is a nonprofit, has been developing it, got a breakthrough therapy designation with the FDA. MDMA is probably the most advanced psychedelic in terms of clinical trials. It's in a phase 3, and I think very close to a potential approval based on everything that we hear coming out of MAPS and the FDA. What we saw as the opportunity was Dr. Liechty was, the leading researcher on MDMA. He was also the leading researcher on LSD. What we want to eventually look at is creating a combination of both MDMA and LSD, potentially into a single dose or administering them at the same time during a therapy session. We think that in a pathogen like MDMA has some very therapeutic, has a lot of therapeutic potential. And probably even more so when combined with something like LSD. And so I think this is a key thing, if you're an investor in the space, I'm looking for real true innovation, things that are going to be next gen and are going to be differentiators. And that's what MindMed is really focused on, really pushing the boundaries here on psychedelic therapy and psychedelic medicines.
MindMed is expanding its phase 2A clinical trial of LSD and ADHD and adding an additional trial site in Basel, Switzerland. What was the strategy behind this, and why is LSD microdosing such a hot topic right now?
Yeah, so microdosing has been a trend in Silicon Valley for a number of years, really sort of kind of picked up with a book called The Psychedelic Explorer's Guide by James Fadiman, and really kind of became folklore in Silicon Valley. A lot of the smartest people in a lot of these large tech companies kind of swear by microdosing. And so I was exposed to that, being an earlier employee at Uber and part of the Y Combinator program. But what we didn't really see was there's plenty of anecdotal evidence, but there was no real phase 2 clinical data showing the efficacy of it, right? And so what MindMed has done is establish the first phase 2 trial ever for microdosing of LSD for adult ADHD. And we are looking to see if we can help people try some other form of medicine besides these stimulant-based medicines like Ritalin, and Adderall that are traditionally used to treat ADHD and have terrible side effects. I know that they have terrible side effects. I was put on them since I was the age of 13. So definitely a real mission for me on how we can find an innovative medicine for adult ADHD.
Project Lucy, MindMed's commercial drug development program, was launched on June 4th. Can you tell us more about your latest project?
Yeah, so Project Lucy is probably the biggest announcement we've had since really going public. It's a huge opportunity. Anxiety affects 40 million Americans every year. It's the most prevalent mental illness in the United States. And it's only getting worse during the midst of COVID right now. We saw Xanax prescriptions just in the month of March increase 14.5%. Overall, since the beginning of COVID, these anxiety medications have also increased 32% as a whole. And so those are not great substances. Xanax is highly addictive. It has a lot of negative side effects. And I think if you know anyone that's used it, it can get dangerous at times. What we are trying to do is to find a non-benzodiazepine, which is effectively Xanax, and look at a therapy-assisted solution to anxiety. And so Project Lucy is based on LSD, and it will be our first therapy-based solution in our pipeline. What's really interesting about this is when we acquired all that data from Basel, we also acquired an earlier phase 2 study that is testing LSD for anxiety based in the same way. What we're now trying to do is take that trial and start a new trial in the United States, and we're asking permission from the FDA to start that trial. And we think that there's a pretty good chance that they'll be receptive to this. We have obviously need to put together all the data to have that discussion, but we think this is going to be a big part of what we are executing on.
Now, we've got a large group of investors that like to watch from all over the world, and they're looking at MindMed and they're wondering, what's coming up. So what upcoming milestones can investors expect from MindMed for the rest of this year?
Well, I think you should look at us starting 2 phase 2 studies by the end of this year in the microdosing study, microdosing clinical trial, and then also our addiction treatment, which we haven't really talked much about today, 18MC, which is currently finishing up some phase 1 studies and will be moving into a phase 2. And so those are 2 good inflection points by the end of the year to be looking for. And then as we progress, over into next year, start looking for potential updates on those trials, how they're going, recruitment. Ultimately, psychedelics is a drug development play. You need to know that going into this. And companies that are not taking an FDA pathway and are not focused on drug development, I frankly don't think they will be successful really commercializing psychedelics. These are medicines. They aren't recreational. We don't see a recreational future. So you need to make sure that the teams that you're backing have that drug development experience. There's more PhDs and MDs on our team than I have fingers for. I think it's really an important thing to evaluate.
Now, if you're an investor or someone that's interested in the company, interested in getting in contact with you, what's the best way for anyone to get a hold of you?
Well, they can email invest@mindmed.co. I, along with my colleague Colin, monitor that email inbox, and we try to stay as best in touch with our shareholders as possible. We really value our shareholder base, and so definitely reach out. Also, just read the news. We've been in the Wall Street Journal to Vice to Bloomberg. There's been a lot of great coverage of our company, and I think that we are quickly establishing ourselves as one of the stalwarts of this industry, and we'll hopefully be a leader for a long time.
Well, thank you so much for your time today, JR. Keep up all the great work. This is JR Ron, the CEO of MindMed, a company that I believe is undervalued, underappreciated, underexposed. Keep it on your watch list. Keep it on your radar. This is Rich from Rich TV Live. Have yourselves a nice day.